Okay, Angela, today we are going to talk about back pain, neck pain also, but primarily what we're going to talk about is going to be a lot more related to lower back pain. And it's an important topic, obviously, because it's a large percentage of what I'm treating on a regular and daily basis, but it affects almost everyone at some point. So it's the number one cause of disability worldwide. And at some point, 80% of the population is going to experience a major episode of back pain that's going to interrupt their daily life at some point in their life. And so there's a lot of questions and misperceptions, and I think the internet is full of information that some of it is really good and some of it is not so good. From what I've been able to, from what patients come in and they're Googling symptoms and what is this, and I think I have this, or I've been to this physical therapist or this doctor and they've told me I had this. And so what we have done with our new rebranding and relaunch and new website is we've created a really amazing, basically, quiz that someone can take, and in 6 or 7 questions start to get a better idea of what might be causing their pain. So there's essentially 6 different types of pain that's going to be associated with the spine. And so if we can start to get a better picture of where that pain is coming from, now we have the tools and opportunity to begin to correct and fix that. And so we're gonna break down those 6 different types of causes of back pain today. And so we can kind of work through what do people typically experience when they're having those types of back pain, and then also what can we do about those types of problems. So we're going to walk through those 6 problems. And this is also a complicated.
Right. I was thinking this is so nuanced because just giving someone the conscious awareness that there are different types of pain and the degree and the nuance to how they're feeling it or what they're feeling, sharp or dull or constant, acute. There's just or where it travels. Where does the pain start? Where does the pain go? And all of the nuances inside of that can actually help lead to the underlying issue that's causing that pain. So back pain is not just back pain flat.
Absolutely, yeah. Yeah, and it's amazing. It's amazing on a lot of levels, because somebody can come in and they can sit with no pain.
Right.
If they try to stand up, excruciating pain. The next person can walk in and they can stand up and walk around and have no problems, but as soon as they sit down, excruciating pain. Right? Or, it only hurts when I do this very specific thing, or when I'm rolling over in bed, or it's only in first thing in the morning versus, throughout the rest of the day. And so, absolutely, it's totally nuanced and it's totally individualized. But there's also a lot of characteristics that are common between pain patterns, basically.
It's interesting.
Yeah.
We've even heard of the type of pain where they couldn't walk in the office because they were laid out on their floor and they had no warning signs to what was going on, and all of a sudden they can't move.
Yep. And that's scary. I mean, you just one little sudden wrong move and you're laid out on the floor. And at that point, your mind goes in a million different directions,
Goodness, yes.
right? And usually it's worst case scenario,
Oh,
like
yes.
what's happening
I'm
here?
paralyzed.
Yeah,
Yep.
I'm, uh, immediately jumping to I'm gonna have to have surgery,
Right.
or is this a tumor, or
Right.
something really significant. And the good news is a low percentage. So we're talking 10% of the time these episodes are a red flag
Mm-hmm.
where yes, you need to go to surgery right now,
Right.
or wow, this is a tumor, or there's a cyst pushing on your nerves, or something
We have seen that.
really serious and significant like that. And so that's about 10% of the time.
Mm-hmm.
So 90% of the time, when you have really bad lower back pain, there's a mechanical and a structural issue that's going on that's causing it that can be addressed.
Yes.
And most often, and we'll kind of talk about that with different types of pain, but most often, these are things that build up over a long period of time. Very rarely is it one specific incident. Even if you can relate it to, well, my back started hurting after raking leaves this weekend.
Mm-hmm.
Most of the time, that might have been the straw that broke the camel's back, but more often than not, your back issues have been building up for a long time, and that was just the thing that did it, right? We'll see people who will come in and, their pain, really bad back pain, it just started 3 to 5 days ago, and all they were doing is like picking up a sock up off the floor, right? And we'll take x-rays, and it's clear that their problem has been building up for years. So whether that's because they are a truck driver and bouncing around sitting all day, they're sitting at a computer desk all day, they're on their feet all day. There's just a lot of different reasons on how those things all stack and add up, but very rarely is it the one specific, unless it's a major car accident or, major fall down the stairs, or, barring a really big injury, most of the time it's little things that have built up, which is most health problems, right? Like, when you're talking with somebody about, losing 20 or 30 pounds, they didn't gain that extra weight after one Thanksgiving meal, right? Like, it's been a year of emotional troubles and, just the buildup of that.
Right.
Yeah.
It just makes me sit here and think how important it really is to be so proactive about these things. I think of, right, someone who was in their early 20s, and, it wasn't a major car accident, but like a little fender bender. And, they went in and had x-rays, maybe had an adjustment or two. And as years go by, there are so many variables that can play into just not thinking about it anymore and going on, rather than just really keeping up with maintenance of, making sure that you're checking in. I don't think we're actually thinking about that type of a thing, that it is important to check in and figure out what's going on with your spine, which you're going to tell us a little bit more about, what goes on, as a result of the body even just trying to protect itself.
Yeah. How the body adapts is there's typically really specific patterns of how it does that. And that's what we're going to start to break down now. So the first one that most people automatically jump to and are worried about, which because most of the time it can require surgery, are disc problems. right? Discs are, they are a significant major cause of lower back pain issues.
Tell us what the discs are.
Yeah, so between each vertebrae, it's basically like a jelly-filled sac that gives the spine its motion and mobility.
Oh, okay.
So that's what allows you to be able to really move in multiple planes of direction at once are the discs. Ideally, in the spine, there's 3 curves of the spine, and those curves allow the weight of your body to get distributed evenly throughout all of those disc spaces. When you start to see curve issues, then now more of my body weight is getting focused on certain disc spaces. And over time, those disc spaces are taking too much of that load. The space starts to compress. And just like if I was pushing on a balloon, if I'm squeezing that disc down, it has to go somewhere. Mm-hmm. So as that happens, it starts to bulge. Mm-hmm. And it can bulge in different directions. And depending on the direction that disc begins to bulge, really tells us what type of symptoms somebody's going to have with that. And what's interesting, so we'll start to break down a couple interesting things related to discs and disc injuries. So the first thing is there is a specific set of symptoms that traditionally really correspond to disc issues. So normally that's the worst. It feels worse when you're sitting. Okay. Feels worse when you're bending over. If you are coughing or sneezing or bearing down, going to the bathroom, and that makes your back pain worse, that's a really classic sign that there's a disc problem or issue. And then a lot of times, anytime somebody's getting pain that radiates down the leg or into the butt or down the leg, then that really narrows it down to disc or nerve compression from some other reason. So that's another classic sign. But what's interesting is that people can have, so a large percentage of people. So this one study I'm pulling up here, 30% of people. So they did a study where they just randomly did MRIs on people with pain, without pain. 30% of the people under the age of 50 had bulging discs, but didn't have any pain associated with it. So you're walking around with a bulging disc, and you don't know it, and it's not causing you pain. So that's also why when somebody comes in and they're saying that, they went to an orthopedic doctor and they have a bulging disc, there's been a handful of times where, okay, well, tell me what's going on. Yes, that person had a bulging disc, but that was not where their pain was coming from or having, that's not why they were having problems or issues. And so, that's why we want to actually put our hands on someone and not just take x-rays or just go off of what an MRI shows. Mm-hmm. I mean, that's important, but just because somebody has a bulging disc doesn't mean that that's where their pain is coming from as well. Mm-hmm. So if somebody does have a bulging disc in the office, I would say that's probably our most when somebody's coming in, that's one of the first things we're screening for is a bulging disc, because our spinal decompression table does such an amazing job at addressing that problem and issue. And there's bulging discs, there's herniated discs, there's different varying levels and degrees of what can be going on with the disc, and that's where the MRI is important. But barring the situation where the disc is basically ruptured and the fluids are leaking out of the disc, we see amazing results with our decompression table and bulging discs. Other things that we can kind of do in the office, chiropractic. Normally, if I'm doing chiropractic on somebody with a bulging disc, it's actually going to be higher up in the spine and just more posture focused, so we can take stress off of that lower back. But we can also include other things. So like cold laser is really awesome for lower back pain and disc issues. Trigenics, which is a neuromuscular technique, that's great for discs and addressing some of those soft tissues around it.
That's so good. Explain decompression. So when we have a bulging disc and we're losing space, what is it that decompression can do that stretching and exercise and physical therapy cannot?
So each of those has a really important role in helping someone. But decompression itself is amazing in the beginning stages of somebody having those problems, so we can get them relief, and then they can begin to start to do some of those other things. But essentially what's happening is as we're stretching, so normally somebody is laying flat on our table and we'll put a belt around their hips and waist, and the table opens up and separates, and we're able to apply more than just a traction to the spine. So it's different than like spinal traction.
Right.
Decompression is different in a way that traction is just a pull and it just holds that. Decompression pulls it and then releases, and pulls and releases. And that acts as a pump in the joints and in the disc spaces. Essentially what we're trying to do is as it's pulling and it's opening up those spaces, it grabs nutrients, or it pulls nutrients from the ends of the bone into the disc.
And almost rehydrates.
Yes. And so over time, water has to follow those nutrients into the disc.
Okay.
And through over a series of treatments, we can see a rehydration. So I was just going through this with a patient today. We were looking at our MRI results, and she had 2 bulging discs, and on the MRI, they show up as just black because there's no fluid or water in those discs. And so sometimes patients get confused by that and think that they just need to drink more water.
I hear that. Yes.
But the amount of water that you drink has absolutely nothing to do with how healthy your disc spaces are. Drinking more water is not going to rehydrate your disc. Motion with decompression and exercise and movement will absolutely do that, but just drinking more water is not going to rehydrate your disc. So I try to explain that to people, and there's certainly some people who they just hear rehydration and they think the only thing they need to do to fix their back is drink more water. And it's like, I don't know what I just said to make you think that, but that is not the solution.
The nutrients we're pulling into the disc is coming from
the bones.
That's right.
Yes. Your vertebrae, not water that you drink.
There you go.
Yes. So yes, that's essentially what decompression is doing. And then as those disc spaces become more hydrated, they get more thick, And that's when we can see like a disc bulge start to resect, so pull back in basically. Sometimes that can happen. And sometimes just getting rehydration. Again, somebody may have a disc bulge, but if we can increase that space enough, now it's not putting compression on the nerves.
Talk about
The
that.
symptoms start to go away.
Talk
Because like we
about
just said, 30% of the
yes.
population may have disc bulges and not have any pain or symptoms around it.
But some people are experiencing excruciating pain. So talk about how that bulge can cause nerve entrapment. How do you see nerve entrapment manifest? What are the ways we see?
Yeah, so there's essentially holes that the nerves come out of. So between the vertebrae and right behind the disc is where nerves come out, and then they go to everywhere else in the body. And so if the space between the vertebrae gets smaller, that's going to make that hole that the nerve comes out of get smaller. That's stenosis, which we'll talk about. But also, as that happens, as that space gets smaller, now if you add a bulging disc into that space, it's going to compress either the nerves that are coming down through the spinal cord or the nerves that can come out of the hole between the two vertebrae. So yes, bulging discs are can be very manageable. Of course, there's a time when you need surgery. Right. But surgery is certainly not the only way to help somebody with a bulging disc.
Right.
And, our philosophy clearly is let's go least invasive to most invasive.
That's right. And I don't want to go off on a rabbit trail, but I do want to come back around to this because there are a lot of people who are very unaware of the cascade that begins to happen once you have surgery. So I want to talk about that because it's less commonly known that you're not just signing up for one surgery at that.
Oh, yeah. I mean,
time.
Statistically, within 7 years, you're looking at a second surgery.
And we are because
once you normally that statistic is referring to people who have fusions. Right. And so if you fuse 2 or more vertebrae together in the back, that motion and extra movement has to go somewhere.
That's right.
And it goes to the joints above and below that were fused.
And now those discs.
And so now those discs start to wear out faster. And oftentimes they were already stressed before the surgery, and it just speeds that process up. So, yeah, with a fusion, within 7 years, there's a high percentage of people that need a second surgery, just because of the.
Makes sense.
Yeah. Now, again, some people, you have those discs are completely blown out, and that's the only way they're going to function.
That's right.
Right. But again, that is not the high percentage of people. High percentage of people are, if we can change structurally what's happening, and you can change habitually what your habits are, and we can address other lifestyle factors, it's not a life sentence for lower back pain.
Wow.
So the next type of pain that most commonly gets confused with probably disc issues, because it's just a really chronic pain that just kind of spreads across the whole lower back, are what's called facet or arthritic pain. So your facets are the joints that are actually in the back. So like when I'm pushing on someone's back, the big bump in the back is called a spinous process, but right off to the side of that are called facet joints. And that's how the spine actually stacks on top of each other. Those are also like guardrails to the spine. So, that's why you can't do a 360 as you're turning around, right?
Mm-hmm.
You have a certain amount of range of motion that you're supposed to have, but it's also not an extreme range of motion where things just dislocate on their own, right? So it's like a guardrail. The problem is when oftentimes because of postural issues or weight is a big part of that. That's where people like are really typically leaning back a lot. So most classically, we'll see, the head and shoulders kind of round forward, and then somebody as they're standing will lean back, right? Like some people come in and they're like, I've always had this giant arch in my lower back, or I've always they'll call it sway back, right? What that person is doing is really loading up those joints in the lower back. Imagine constantly doing like a back bend or where you're arching your back. Those joints just get compressed, and that can cause arthritis and degeneration a lot faster in the spine. Also, what we see a lot is around those joints are capsules. And so if those joints are constantly getting compressed all the time, then the capsules around those joints become inflamed, and that causes pain. So most classically, it's the, lower back pain right in the middle of the lower back, kind of spreads across the lower back. It doesn't come into the butt or down the legs. It's worse when you try to lean back. It's also worse when you've been standing. Like if you've been standing for a long period of time, or you've been walking for a long period of time, and then your lower back is just killing you. That's very commonly coming from these facet joints. And then it feels better when you're sitting or bending forward. So that's another one that decompression works really well for. But that's also one where we would really want to focus on posture, lifestyle, do some adjusting with that. But it's crazy, this type of problem, over half the population has. So if we x-rayed 100 people right now, 60% of them are going to have showing up on x-rays, these facet joints being compressed and starting to show signs of arthritis and degeneration. And that's one of the ones that is absolutely correctable with lifestyle and really conservative treatments.
I remember my mind being blown when I really learned what arthritis and degeneration actually was. So the body has this innate intelligence to protect and create a brace for places of pain or trauma or injury, right? So what the body does is it starts to build more bone around those areas, which you wouldn't think would be problematic until you understand and realize that the more bone and the more calcification means less mobility, and also actually solidifying the nerve entrapment right where it is.
Yeah, absolutely. So, typically because of these curve issues, certain discs or joints, like I said earlier, are carrying more load than they should be, than they're designed to.
Right.
And so you magnify that for multiple hours a day over years period of time, your body, to try to protect that joint and help it puts more bone there to try to stabilize it. And absolutely, over time, it's an intelligent process for the body's perspective, but for us, that means limited mobility. It means, a chance that those joints will actually fuse together, and then we have no mobility. Those bone spurs can also be what's causing and compressing and creating that inflammation and stress on the nerves that then are causing major issues. So it's an intelligent process. Degeneration is your body is smart. It's stabilizing joints that are doing jobs they're not designed to do. But there's also some permanency in it. And, depending on the level that we see when someone comes in, our conversation is first priority, let's stop that from getting worse. Mm-hmm. Second priority, depending on where they're at on that continuum, now let's talk about how much change can we see in the opposite direction. Sometimes we can see a full correction in what that disc and joint looks like. And sometimes that's been going on for such a long period of time, we're not going to get someone's curve back to what would a normal curve degree be. If they have tremendous amount of bone spurring going on, it's, we're not going to get that to go away, but we can certainly take the stress off of it, stop it from getting worse, and see some positive movement in the other direction so that doesn't continue, and see a relief of symptoms. So those would be probably the top two, I would say the top two things that we see and really help people conservatively address with decompression, adjusting, cold laser. What's really makes a big difference for the arthritis and facet joint pain can also be orthotics. So a lot of times people are really surprised when one of the first questions I ask them when they're talking about their lower back pain is, do you also have any kind of problems with your feet and ankles? Because depending on when someone's standing or when they're walking, if that's a major sign of pain, like if it's worse when you're standing or you're walking through the grocery store, we definitely want to assess whether part of the reason you're feeling it in your lower back is actually because you have completely flat feet, and that's addressing and changing how you're walking and how that lower back is getting used basically as you're walking. Another kind of common reason that we'll see and most people, so is muscles. So muscles and soft tissues causing back pain. Typically, if people are coming in with this type of problem, we don't see it as much because most people wait to come into our office. If they think it's a muscle issue, they wait, right? Mm-hmm. And then when it's been like, okay, it's been a week, it's been 2 weeks, it's been 3 months, and the pain hasn't gone away, okay, maybe it's not muscular anymore, right? Mm-hmm. They're typically like, let me wait and see if this kind of calms down on its own. Mm-hmm. And if they're coming into our office, it's usually hasn't, right? Mm-hmm. But the symptoms are going to be dull, achy, tight. This is the type of problem that, I was raking leaves all weekend, bending and twisting, and man, my lower back is just really tight now, right? That's not going to be, I'm getting pain down the back of my legs. Mm-hmm. It's going to be some tightness. And essentially your muscles are trying to protect your spine from doing something that it shouldn't be doing. And so, normally it's the people, what we'll do for this is there's some awesome stretches that we can show for people. We want to address posturally what's going on. We also want to look at, just a general stabilization, right? I'm a big fan of Stuart McGill. He's a researcher, and he has 3 exercises that are amazing for lower back, almost all lower back, different types of pain. But it's stabilizing the trunk, right? And so your trunk and your midsection is like a big tube, and if it's really, really tight on one side and really, really weak on the other side, then that causes big imbalances in that tube. And so if you can stabilize, all around that tube, then it takes stress off of your spine. Your spine's not having to carry as much of that because everything else is a lot more strong and stable. And so, that's when we're working with posture pictures and a lot of times giving exercises for somebody to do at home when we're dealing with the muscle and soft tissue. But I would say that's probably one of the least common reasons that we typically see somebody in the office, because those usually resolve a lot faster than some of these other problems. The next one is nerve compression and spinal stenosis. So one of my favorite movie and show quotes is, spinal stenosis is no laughing matter. And it's really not, because, essentially as the spine, as those disc spaces get smaller, stenosis just means a narrowing of a hole. So the hole that the nerve comes out of is too small, and you get compression and inflammation around that, and that's what is causing pinching of that nerve. So pinched nerve is really, a lot of what we're talking about that. So there's a lot of, anytime somebody has stenosis, it's usually accompanied by other problems. And a lot of times people, will have more than one issue. And so, but the symptoms of this are sharp burning, tingling, weakness. It improves when they're leaning forward. So the classic example of this is somebody who has to be like leaning on the shopping cart when they're at the grocery store, right? Like if I try to stand up straight, or if I'm walking up straight, waiting in line somewhere, it kills me. But if I'm leaning forward and I'm using that shopping cart as to walk through the store, no problem. I feel great. That's super classic sign, and that that's something that we hear a lot is, I'm having to lean on this shopping cart, or I'm having to lean forward on this. Sometimes it's, people will have walkers because it's that forward leaning motion. But, because that hole has gotten narrowed, often they're also dealing with probably disc issues, degenerative issues. They're dealing with facet problems. Like normally if that hole is narrowed and that's pinching a nerve, that's not your only problem. That's, there's usually a cluster of issues that all kind of work together. The good thing with the nerve compression, though, is that the pain that somebody's feeling is a lot of times related to like the sensitivity, so inflammation around a nerve, more than that nerve actually becoming compressed and like damaged. And so a lot of times we can, we'll see, anytime somebody thinks that they have a pinched nerve, or we can see that on an MRI. It's usually not a matter of like we're worried about that nerve becoming like permanently damaged. Right. That takes a pretty significant amount of time for that to happen. Now, if somebody has had this issue for years, then the conversation is, look, even if we get the nerve, the compression off of your nerve, that nerve has to heal. And so that is going to take some time. And, that's difficult to manage with some people because we want to make sure that we actually have gotten the compression off there. But unfortunately, stenosis is actually one of the major causes of surgery. So, in fact, spinal stenosis is the number one reason for spine surgery in adults over 65. So, again, that's because so many of these factors all come together. But most of the reason that these are happening in the first place are problems that can be addressed with really targeted strategies. So in the office, again, we're mostly focused on decompression adjustments, Trigenics, and cold laser. Those are all, especially the cold laser, phenomenal for nerve types of problems. And depending on what's really causing the spinal stenosis, that's what we want to dig into and see what other therapies are going to be really beneficial for that. The last two reasons for this are very similar, but there's some subtle differences. The first one is instability, and then the last one is posture. So instability is typically when you feel a lot of pain when you roll from one side to the other side in bed. When you're going from standing to sitting or from sitting to standing, that instability, but then you feel better at the ends of either of those, right? Or it feels like the back is like catching or giving out. Like those are classic signs of instability. They typically need more stabilizing and strengthening than they do stretching. And normally we'll do some of both. I like to start with kind of mobility and stretching, and then once we're getting somebody a little bit more pain-free, then move into more of the strengthening and stability. And then that also goes into like the postural aspect of pain, back pain. So whether that's neck pain, middle back pain, lower back pain, this is where somebody's sitting 8 hours a day. Essentially if you're sitting for 8 hours a day and you're only getting up, a couple of times, you're at a 90% risk of having really major back problems and issues. And this is these are the reasons why, we talk to people about it's not the one-time major problem or it wasn't the picking up that sock off the floor. It was sitting poorly at a computer for 8 hours a day for 15 years, right? That all adds up. And then, you do something silly like turn around and grab something out of the back seat. So one way that we address that is, oftentimes I'll take posture pictures of somebody when they come in, and we can get some measurements and numbers on where they're starting at. And then based on those postures, we'll take those pictures again at reassessment, like say every 4 to 6 weeks or something. And based on how much improvement we see in their posture, then we'll be assigning specific exercises based on what we're seeing with their posture. And so posture is absolutely correctable for people. I have to have that conversation occasionally where it's like, well, my mother and my grandmother both had really bad posture, and so I'm just stuck with bad posture. And it's like, well, not really. You don't have to subscribe to that. So there's absolutely things that we can do to, whether somebody is in high school, middle school, right? Like we see tons of kids with really bad posture because they're just looking down at their phones all day, or whether somebody is in their, 80s, 90s, I'm still having posture conversations with those people, because obviously how we address that's going to be different, and what we're hoping to get out of that's going to be different. But there's still things that we can do, still things they can do to help with all of that. So back pain, to kind of wrap things up here, back pain is not random, right? It's typically going to fall into one of these 6 categories. And our goal is, when you first come in, figure out which of these categories is most making sense based on what we're seeing, what you're feeling, what the imaging shows us, whether we're taking x-rays or whether somebody's coming in with an MRI of their own. But if there's anything that I want to leave people with, it's a high percentage of the time there's a handful of things that we can do to address and alleviate and give people hope and give them their life back, because back pain is super disruptive for people. And so if we can, I would encourage you, the listener, to, jump on our website, take our assessment, find out, if you're struggling or have had issues with back pain in the past, or you're just wondering where you score now. It'll tell you kind of which of these 6 causes might be your primary reason for that. And then, obviously, if you have questions or problems, then we're here for you, and we want to be your resource in helping you manage and solve these issues.